Nigeria's health insurance scheme, NHIS, which came into force some 17 years ago, still faces a number of challenges. Shortage of funds, misappropriation, inherent lapses in the NHIS Act have accumulated, painting a negative perception by the public about the scheme. And TVC News' Joke Adisa takes a look at a health insurance system which is expected to take the burden of health finance off those enrolled in the scheme.
Nigeria joined the League of Countries with National Health Scheme in 1999 when former President Olusegun Obasanjo signed the National Health Insurance Scheme into law. The scheme was created to provide a subsidized and universal healthcare access to every citizen through monthly deductions from the salaries of workers in the public sector. 17 years after, the percentage of the Nigerian population with healthcare coverage remains stuck at a paltry 10%. Many stakeholders attribute this to the noticeable gaps in the Act, which restricts beneficiaries to federal workers. Those enrolled in the scheme believe the NHIS is well conceived, but lament the alleged corrupt tendencies of its managers.
When my son was sick, I took him to my health provider. It was only paracetamol they gave him. They refused to run tests. For 2 days, my child cannot sleep. I have to take my child to another private clinic. They have to run tests for him. Through the tests, they discovered that he was having malaria and typhoid. So since then, I've been so discouraged. For 2 years now, I did not go to my health provider.
My wife delivered in Federal Staff Hospital, Jabi, and everything was covered by NHIS. I think it's a nice program.
When doctor prescribe a good drug, or maybe that drug is expensive, the NHIS will say they don't have it.
Principal actors admit inherent lapses have crippled the good intent of the scheme and say it must be energized.
Over 20 complaints that enrollees have about primary healthcare, about healthcare providers. One of those is they have been overcharged. They have been charged for whatever has been paid for in the NHIS scheme. They are not being refunded for what they are supposed to be refunded. Drugs are out of stock. This out of stock syndrome. The primary problem is we need to enforce what is already in the law books.
A lot of process will need to be put into place to sanitize what actually have been undone. Because at the time, I have even a cause to have written to Mr. President about the fact that these funds are not revenue. They are funds from contributors, fee for service, and therefore workers that have parted with their 10% medical allowance expect an expanded scope of coverage.
Opinions are divided among participants as to its effectiveness, but they all say government must take another look at the scheme to realize its laudable goals.
I can tell you that what I'm experiencing is what other people are experiencing as well. They are just taking our money, they are not providing the health facility which we need. So my concern is that government should look into it, or in other cases they should stop the scheme.
NHIS should be overhauled.
The way out is for government to maybe to fund the establishment, the commission, to empower them with funds.
The NHIS authorities also share the people's views and say it is beginning a nationwide mobilization for the scheme.
We're reaching out to all state governors. We need the state governors to take up insurance in their state to be able to fund healthcare for their people. We're meeting clerics, we're meeting community leaders to expand the reach of healthcare to all Nigerians.
Key actors believe a review of the NHIS Act and sincerity of purpose in its execution from all sides will contribute to attaining its goals. Joke Adisa, TVC News, Abuja.